Naz from Yorkshire Peaches Therapies, and welcome back to another episode of Hop, Skip and a Jump. On today's episode, I'm joined by the incredible Ruth from Photizo. Now, I have worked with Photizo for a lot of years, and I am proudly a Photizo ambassador. In this episode, we take a deep dive into photobiomodulation, how I use Photizo in clinic, and of course there's going to be more follow-up with this episode because Ruth is a absolute font of knowledge when it comes to light and also healing with light. So I'm going to stop talking. Let's jump into it. Ruth, thank you so much for joining me this morning. It's a very dull morning today in Yorkshire. I understand it's the same down your end as well.
Yes, it's been lashing down all night.
Hideous, absolutely hideous. But today we are going to shed some light on our dull situation. See what I did there? So, Ruth, you are Photizo, UK Photizo distributor. Obviously, I talk a lot about Photizo. I've been an ambassador for Photizo for I don't know how many years. I probably should know.
Quite a few.
Quite a few years. So, for people who haven't heard of Photizo, haven't heard about photobiomodulation, let's unpick that a little bit. So, what is Photizo?
Okay, so Photizo is, I guess you would describe it as an ultra modern, very easy to use, and I will use the word photobiomodulation. It's a bit of a mouthful, but it's the agreed scientific terminology for the type of light therapy that predominantly delivers red and near infrared light in specific doses to produce a biostimulatory effect on the body.
That's a really good explanation. I like that.
So interestingly, red light, because we all use these funky kind of decorative LEDs these days, red light does not mean that it's necessarily therapeutic.
Yeah, so red light as a whole, and there's I've seen a lot of different red light therapy kind of pop up. I'd say probably it's intensified over the past 4-5 years, something like that, but in the beauty care industry, and people are using a lot of, like, they have the big masks and stuff, don't they?
And they plug red light masks on reality shows, and everyone gets on the bandwagon and makes all these wonderful claims if they see fancy TikTok or Instagram reels or whatever. But
with Photizo then, so if we hang on, wait a minute, we're going to circle back to this term photobiomodulation. So for people who've never come across that term before, how would you describe it, say in layman's terms?
Okay, so it delivers photons, light. Bio means body, biological. Modulation is that it all it essentially does is it has a regulatory effect, a natural effect. And the analogy that I often use with regards to bringing photobiomodulation as a therapeutic modality, therapeutic tool into your mix of whether you're just looking to help with pain or to help stimulate healing or to help with recovery from from sports or whatever. I say, we are all taught about the risks of ultra processed junk food, and it has a very, we do have nutritional deficiencies, and that many a time I've been to events and heard speakers about the subject, that they eat clean and they have all this clean living or whatever, and they have supplements and really look after their diet, but a lot of the time, we are now, because we're now living in very probably a lot of modern lighting systems, and we're not getting out in natural daylight in the sunshine. We are building deficiencies up in our bodies, the same with our animals, in terms of our light diet. So
light diet, I like that.
So I mean, the lack of light or the wrong sort of light or bad quality light can have all sorts of detrimental effects on our biology and that of our animals. But yeah, comparing it to nutrition, so light effectively is a nutrient, you would say, and having good quality light or being aware of how to use light in your everyday living adds that spark to help, especially with the red and the near infrared. The near infrared has been recognized and scientifically proven time and time again that we need near infrared light to fire up this cellular energy, mitochondrial energy. And you know, if our mitochondrial function is severely compromised, which is what we're realizing is the case with our modern living, then it makes sense that if we are able to bring in a great little quality device that is providing efficacious doses of light onto areas of the body that you know just need a bit of a helping hand. It's like in a car engine, you can feed it with lots of good quality fuel, but if your spark plug is knackered,
then it's not going to
go anywhere.
That's a good analogy. I think with photobiomodulation, like, so I work with dogs predominantly, and when I specialize in pain management, so Photizo has been a huge underpinning of my clinical work for 6-7 years. And when we're dealing with systemic inflammation, so that can come from, the way I describe it is, it can be emotional stress, it can be physical stress, so actual tissue damage. When the cells are having to kind of like fight against that inflammation, the energy, the battery depletes so quickly, and Photizo charges it up again. Because when you have a cell in an optimum state and it's fully charged up, it's then able to deal with those systemic inflammatory conditions that we might see. So I use it for all sorts. I use it for absolutely all sorts. So in clinic, it's a mixture of acute doses. So say I'm working on a dog and I'm like, ooh, trigger point, and the dog looks at me and goes, ooh, that's sore. I go, no bother, I'll get the Photizo and I'll apply 2 to 3 doses depending on what the dog is kind of responding with, and then I'll go in. And it's not just the mitochondria that it's affecting, it also stimulates blood flow, I understand.
That's right. It was everything that the body naturally does to repair itself. You know, because, you know, whether we like it or not, we do have this profound ability to self-repair.
Yeah.
Not quite like Wolverine at that stage, but yeah.
With the body is phenomenal at healing. However, certain things, external environmental factors, can impede that healing function. And I think it's really important to remember is that Photizo, the use of photobiomodulation, isn't changing that healing process. It's supporting it. It's kind of just wrapping it and facilitating a better environment for the body to heal. Would you agree?
Absolutely, yeah. It's helping with the efficiency of that natural innate healing. And there is, you know, when the body receives or it gets into a trauma, whether it's by injury, age, disease, shock, and, you know, even if you're into the biological laws of nature and everything, you know, an emotional shock can cause such chemical imbalances, and which leads to that,
and
like
trauma
say,
sits in
yeah,
tissue.
inflammation.
It physically sits in the tissue as well. So
Yeah, yeah. So you've probably realized, yes, with integrating red light therapy into your break, your how you work with animals. And the thing is, the great thing about red light therapy is it doesn't, okay, we up to a point, we do need to be educated and aware that there needs to be we need to be using a device that delivers a range of wavelengths within a recognized therapeutic window, and the dosing, really does need to be within that therapeutic window.
Because actually, if you use it too much, you can reverse the positive effects that you've
Yeah,
had.
there's this, well, in the scientific world, we talk about this biphasic dose response. Where you stimulate the body, and there's this trend, and then it meets a peak, and then it goes into what's called an inhibitory effect. Now, I will say that with regards to the pain relief effects, you are using a bit of a stronger dose somewhat, where you are going into that inhibitory effect, and you're inhibiting pain. So some of the studies have shown that the pain relief effects work very similarly to the pathways used with local anesthetic.
Wow.
So, and that's both in people and animals. But what I think has been really so wonderful with therapists like yourself, Yaz, is to really use it intuitively and recognize that it's not necessarily just about the pain relief, it's about the calming effects that it seems to produce, in especially for our animals.
Yeah.
So there's all sorts of effects, like you say. There's the blood flow, the lymphatic system, there's melatonin, or maybe even happy hormones. And yeah, a lot of very, very stressed animals in pain or shock do seem to be incredibly receptive. I mean, even one of the first case studies or case results and feedback that we got, or early days, was from a wonderful teacher who's connected to Animal Reiki Association, Sarah, and she took a group of students over to Rajasthan in India, to a charity called Tree of Life for Animals, and they were using obviously off the body Reiki techniques, but they have, in that, while Alison was actually there, they brought in a couple of completely malnourished, completely shut off street dogs, puppies that were bald and had multiple issues. And and then in that situation, it is a race against time, because they're so shut down emotionally. They can't be handled. They won't let anybody near them, and it stresses them out even to be handled, or even just try and get some food down them. And all what we were told when Alison came back from that trip was that she just thought, oh, I wonder, and bathed those little pups with the Photizo off the body, but just bathed them. I can't remember exactly how long for, but interestingly, she said that the way that it calmed them down to an extent where the volunteers and the shelter could start handling them and get some nourishment down them, it's that process was speeded up significantly with adding the red light bathing into the mix.
I mean, using the bathing, so when I explain different types of doses, so I'll go cute, we're here, or say if we're wound healing, we're about an inch off. Bathing is just like at a distance, and they've been bathed in the red light. And anecdotally, what I've seen in clinic is nothing short of phenomenal. I've been working with the Photizo device for as long as I've been working clinically, and still I'm in absolute awe of the behavioural effects. So because I specialise in pain management and I provide trauma-informed care, a lot of the dogs that come to me have severe aversion to handling, sometimes even movement around a room. So part of my process is making sure that my energy is still when I first meet these dogs. So I'll do, like, there's a specific meditation that I do before I meet new dogs, and I am a blank canvas and they are the artiste, and they get to paint whatever they want, but I'm just a pillar of stillness and calm. And I'll be talking to the pet parent, but the whole time I will be bathing at a distance the dog in Photizo red light therapy, and just to see them come down from off the ceiling and just take a breath. And I always say, with massage or any kind of the therapy that I do, Yorkshire Peaches therapies, is about allowing and facilitating a space where a dog can reconnect to themselves. Because if you are painful, or if you are struggling with very intense behavioural issues, you can become disconnected from yourself, and that's really frightening. That's not nice. That's not nice. So allowing them to have that safe space to just reconnect. Photizo, if I cannot get my hands on a dog, we bathe. Like, literally, like, the Photizos are always on. I have 4, and they're constantly on. I'm, like, rotating them and charging them up, because they're used in every single session. Every single session, near infrared and infrared light is used, and it has been absolutely the underpinning of all of my clinical work today, and long may it continue. So is there anyone in the photobiomodulation community that's really making waves at the moment, that's really, like, has got some interesting stuff to be talking about? Because we're still trying to understand the scope of this modality.
Yeah, we are, and light in general. So there's we're discovering the mechanisms all the time. That's why we have the organization, there used to be World Association of Laser Therapy, called WALT. They've now changed their name to reflect the scientific change of the fact that it is just delivered by laser light, because it isn't. We've now got these very good quality modern LED systems, some medical grade LEDs being used in many clinical applications in human medicine, non-pharmaceutical human medicine. But yeah, so that body is now called World Association for Photobiomodulation Therapy. So they are pretty much the global body. And as I understand at the moment, there's moves to bring in proper accredited qualifications in this modality, because it's one of the types of light therapy that is got the most research behind it. It's the most studied, and we've got very, very good quality clinical evidence, peer reviewed. The quality of the studies has improved as the years have gone on, but we're reaching 5 decades of
Yes.
now.
And now they're peer reviewed. Woohoo!
Yeah. I mean, I still go back to, okay, there's questions about the quality of peer review. I suppose you do have to look at maybe who funded the study in
Who
the first
funded the
place.
study, the
Yeah,
research group
that's
size,
my
who?
cynical,
Yeah.
cynical. Yeah, but it's the real life results that the and it reports and the stories that has become so profound for us globally as at Photizo, and for us in the UK, we've been so well blessed with how the animal therapy and vet physios, the body workers, the canine therapists, even the wildlife veterinary nurses now are really getting on the bandwagon. How you guys have embraced this modality and brought it into your mix of what you do, and have fed back the most incredible stories of recovery, whatever it is that you're tackling or you're trying to unravel. And that has been so enlightening for the whole global network, for anyone that's involved in Photizo. I think the thing for me about this particular device is it came about from many years of work in using this modality by a very open-minded South African physio, and she was definitely up for using all sorts of pulsing as well, looking at the pulse healing frequencies. So as a device, the Photizo team in the development of it have brought that into the mix of a pre-programmed, very, very quick dose, in the fact that you've got a very unique pulsed sequence of the way the wavelengths are delivered into the body. So whether I think that's what gives Photizo the edge, in terms of how versatile it is across, whether it's a calming device or
Across
more
injuries.
clinical
Yeah.
wound healing.
Yeah.
But yeah, I mean, going back to the people that are doing some phenomenal work, there's obviously, people need to keep an eye on the World Association for Photobiomodulation Therapy. I'm involved with the International Light Association. I've been a member since 2018, helped set up the UK chapter, and we do cover photobiomodulation as one type of light therapy, but we use color, light, and sound. So it's all that frequency medicine.
Yeah.
I know Raw Pet Medics have recently covered the beneficial effects or importance of light, as in the light diet, coming back to circadian rhythm, getting out in the morning. It's important for our dogs, especially, to get that morning light.
Yes.
To set the body clock. It's as important for them as it is for us. Roger Meacock, called the Natural Vet, he has a great Substack. He's done great work on circadian rhythms. He did a blog just when the clocks changed, because those times of year, the timing and the clock changes do cause some issues, for us very, very sensitive
because
animals.
With January, sometimes people can be like, "Oh, new year, new me," and I'm like, actually, if you look at what nature's doing, we're not supposed to be waking up yet.
No, we're supposed to be hibernating.
We're supposed to be hibernating. If you follow along with what nature's done for hundreds of thousands of years, we're still hibernating. Well, that's my excuse anyway. Is that I follow what nature's doing instead, because I don't want to come out of hibernation in January. It's cold. I want to stay in. I want to stay warm. But it's so interesting as well about the coming back to the light diet. So in my clinic, so I'm in my office at the moment, and in my office is it is LED over overhead kind of like strip light, but in clinic I don't use this lighting. It's all soft light lamps. It's soft lighting
Yeah.
from lamps. And I've noticed a difference since moving into this new clinic space, that actually it makes me feel better. And it makes the, like, even the pet parents who bring their dogs to me, they're like, oh, it's so relaxing in here, it's so calm. I think because we are constantly, like, our entire world, like when we look at our phone screen, when I'm looking at the computer screen, we just constantly have this glaring light.
Yeah.
And
It's not just glaring though, Yaz. Unfortunately, there has been, like many situations with so-called advancement, is that technology gets rolled out in such a rush, but it's not properly tested for the effects it might have on our biology. So what has been very well covered with some of the scientists and the researchers and lighting designers in the International Light Association, and that's a phenomenal resource to self-educate about the importance of getting the right light, not exposing yourself to the wrong light at the wrong times, getting enough of the right light, and that sort of thing for our whole well-being. And so I'm sad to say that this drive for energy efficiency with these modern LED lighting systems has been rolled out in cars and street lights and buildings, even hospital institutions where you've got quite poorly people, and the lighting is like dire. It's because they're noisy. They're really there's this flicker that you might not always notice with your naked eye, but it's there.
If you film in slow motion on your phone, you can see the flicker comes up.
Yeah.
And that's what we're continually exposed to. And I had a question as to whether or not that's what dogs see all the time because of how they process light. I don't know. I don't have the answer to that, but it'd be interesting to know. They're constantly seeing this flickering. Who knows?
Yeah, who knows? Because obviously, there's different sorts of animals that see infrared light, or you've got you've got the UV, the blue light spectrum, the short high frequency end of the visible light spectrum going into invisible, and obviously that has an ionizing effect on our biology. Animals, I know bats are highly sensitive to UV. And we've been quite blessed that one of the most well-known bat rehabilitation centres over in Ireland has picked up using red light therapy for this wing wasting disease, and she just bathes the bats in this light, and she said it's been pretty phenomenal, really, with the results she's getting. So there's animals that are very, very sensitive to that UV blue light spectrum. It has antibacterial properties for sure, but you do need to limit your exposure. Whereas in the photobiomodulation world, you're looking at the other end of the visible light spectrum. So you've got the low frequency, long wavelengths. It's that soft kind of replication of that first dawn and the sunset. It's quite, it's like almost going back to tribal times, looking at firelight and that sort of thing, and our bodies are very, very in sync, and the animals are very in sync to those changes throughout the day of the hues of light, and it's so important that we get as much natural light as possible. But the red light, I think, or certainly using in your surroundings, like, I don't know, salt lamps or
Oh yeah,
very
I've got one in clinic.
yeah. Well, the old what they call them, incandescent light bulbs are probably the most safest, really, and best for health. And I think if you shop around, you can still get them. In the ILA, International Light Association, there's been an absolutely brilliant physicist that has invented all sorts of very, very clean LED mood and brain entrainment lights, and he's got a little detector that you can use for all your devices, like your screens or your lamps or your overhead lights, and it detects very noisy light. It buzzes like you wouldn't believe. Yeah, it picks it up. So I can see that technology is going to come, so we can actually measure how good or how bad these modern lights are. Yeah, and I think, you know, in the long run, it's going to, you know, we've got to address it. We've definitely got to address it, because it is that this bad light dial, or this junk light, like junk food, is contributing to chronic
disease.
Yeah, and inflammation.
Which is, I talk about inflammation a lot. I talk about emotional inflammation, digestive inflammation. And it's for me, it's not about completely eradicating inflammation. Inflammation is addressing an issue because it's part of the body's healing mechanism. So the body wouldn't know to heal if we didn't have inflammation. So if we have this chronic inflammation all the time, what is causing the issue in the first place? Take it a step back and have a look at it. So, Ruth, obviously you're going to have to come back, because we have coming up the world's biggest dog show, Crufts, and we have so much more to talk about before we get there. I'll be there doing demonstrations and there to answer people's questions about photobiomodulation.
Showed it yet?
Oh, there it is.
You use that was the first unit we well, actually that's a silent one.
Yeah.
So for very sensitive animals, it doesn't beep.
Yeah.
Yeah. So you'll be there with yours.
I mean, some dogs I have like 3 on the go at once whilst I'm working on them, the robust doggies. So,
but if I can just mention,
yeah, of course,
one of the most frequently asked questions is, well, why have we got all these different models? Which one do I choose?
Which one do I choose? Well, colour preference. No, it's not.
No, we launched Photizo in the UK initially with the BP vet care. Bringing a device to market for animal application is much, much quicker than a medical device. So we are very privileged that the manufacturing team, the engineers, and it's still a family-run business like we are, but they persevered, and we've got the other units that are certified medical devices,
which is such an accolade achievement for Photizo. The way that I kind of describe the differences to people, so when it's, you know, it's five units, you've got vet care silent, pain relief, blush.
Actually, with the silent.
Oh, 6, yes, of course.
The blush, is certified as a beauty device. So the reason is just either the licensing or between the 3 clinical units, the pre-programmed dose is varied to make it more specific for that clinical claim.
Yeah.
So you do ideally need to alter the dose, whether you're treating a wound or whether you're using it for a pain relief effect.
Yeah.
But essentially, all of the Photizo units, they all deliver the same 2 wavelengths concurrently. They all have this unique pulsed sequence in the first part of the dose, which has it helps with how the light resonates through different tissue types. And these healing frequencies have been recognized for many years about with regards to the kind of emotional effects that they might create and that sort of thing. It's a bit woo-woo for some people, I get it.
Well, we love woo-woo in this house, but for me, like, Photizo isn't woo-woo and light isn't woo. To me, it just makes total sense. It just makes total, like, of course this is going to make a difference. So across kind of like the product range of Photizo, I always say it's the same ingredients, it's just a slightly different recipe in each one, depending on what you're targeting.
Yeah,
So,
and using it correctly for that individual situation and consistently,
yes,
like you would approach taking herbal supplements and remedies and that sort of thing. It's not
a one fix
a treatment for 5 minutes and then stick it in a drawer for 2 weeks.
No, it's a commitment to the process. The body is complex, therefore its healing process can be complex. And it's not to, like, I always say, like, I have a very, I absolutely love everything natural, but also have a strong appreciation for pharmaceutical. What you have to remember with natural is that there does have to be that additional commitment. You're not going to potentially get the, if you've got a scratch and you do 1 dose of Photizo, it's not going to heal straight away. You have to keep doing it, and that's where the real magic of Photizo happens. But
and using it with that like what you bang on about, is
go on.
Consent-based treatment.
Yes, oh my days. We need to do a whole other podcast about consent-based treatment, especially when we are working with dogs that are traumatized, dogs that are shut down and stuff, and how Photizo, because you're right, I do bang on about consent-based treatment, but it is so important to give painful dogs, chronically painful dogs, or dogs that are painful and they've got complex behavioural needs, to give them back agency and autonomy over their own body. But I could literally talk for another half an hour about it, so you're gonna have to come back, Ruth, because we need to pick up on that conversation.
Especially because it obviously there's different types of red light products now that are coming on the market, and we're all about trying to educate the animal owner or guardian to make an informed choice and not be necessarily caught up in this crazy trend that's going on at the moment, because Paris Hilton happens to use a red light mask on a dog, and it's been claimed that it let her dog live longer or something like that.
You have to be so careful about the claims that you make, especially when you're. It's almost like tapping into people's vulnerabilities. So, of course, everyone wants their dog to live until they're 20. So, of course, they'll go and buy the big face unit, the exact same one that Paris Hilton had. And it's like, no, you have to be so careful about what you say. And I'm very passionate about pet parents making informed decisions. So, here's the evidence. Here's what's available to you. You pick what's best. You pick what's best for you and your dog.
Just trying to go as cheap as chips on big e-commerce sites that make all the singing, dancing, might have library shots suggesting that it's the be all and end all, making those claims. But if they're not giving you details,
specific doses, then what are you paying for?
It's about the servicing. If you're buying a product from goodness knows where, if it does go wrong, where do you get it fixed?
Whereas Photizo you have your own dedicated.
It's got a 2-year warranty, and there's a service centre, medical equipment service centre. I mean, obviously we have to cover that because of all the medical licensing that we've got with the human models that are, now we've there's progress with one of the units being used in a very specialist clinic in the NHS.
I'm like that.
I won't say too much, but I mean, it's really good news that the NHS and the clinicians are starting to recognise how beneficial photobiomodulation, when it's used properly, can be incredibly useful for patients that
wound healing. It's phenomenal.
Well, it's not so much in wound healing yet, but it's on the NICE guidelines for a condition called oral mucositis, which is a horrendous, horrific side effect from chemo and cancer treatment, where the whole esophagus gets ulcerated.
Oh, that sounds really painful as well, which will also impact on someone's immune system, because the mucosal lining of your nose and your mouth is your first line of defense, and then if you've already had chemotherapy, which wipes out everything.
Yeah.
Gosh.
But of course, that we wouldn't have a hope if we didn't have a medical license.
Yeah.
To be
to even be considered.
I'm not saying that we've got, that at the moment that the Photizo is not the device that they're using in a clinical practice. There's a dedicated professional level photobiomodulation device that has got that, but they are what the clinicians are looking at now is realizing how beneficial it is, and rather than getting the patients back into the clinic, there's too many of them, they're expanding out into the home use photobiomodulation service. So that's what's being looked at. It's all very, very promising.
It's very exciting. I'm
very
like
promising. Yeah.
It's so exciting. So I think we need to talk about in our next episode what's coming up at Crufts. I want to talk about some more case studies, because we've very lightly touched on some of the species that Photizo has been used as case studies with, and there's so many more fantastic stories and cases, whether it be wound healing or there's just so much. But I'm gonna cut us off there, because otherwise we will talk for the next 3 hours about photobiomodulation. So, Ruth, for people who have listened to this podcast and they're like, I want to find out a little bit more about this Photizo, where can they find you on social media and the internet?
Cool. Okay. Well, just say we're still transferring information from our old website platform to our new one. Not all the blogs are on there yet. We had to do it in a rush because the girlie that was building it for us, she was finishing it, doing as much as she could on the Friday, and she was having an elective cesarean on the Monday, so we had to kind of get
everything rushed over.
But anyway, so blogs are going on. So we are not Photizo. Well, I think you can use photizo.co.uk that will get to us as a business, but our business name is Daintree Health Products. DaintreeHealthProducts.com. That's our website. If you go on the manufacturer's website by accident, they will be able to tell that you're in the UK, and they'll just shove you back to us anyway. But all our social media tags, we don't do X.
No,
Twitter.
I don't do that. You've got Facebook and Instagram.
Instagram and YouTube, and it's
YouTube, yes.
Photizo. Our tag is Photizo UK.
Perfect. Well, Ruth, thank you so much for your time this morning. I could just sit and listen to you talk about photobiomodulation for hours, and have done, and I'm still learning. Even now, using this modality for, is it 6 or 7 years? I can't remember now. I'll have to work that out actually. But For those of you who've been listening, I hope you have enjoyed this episode. Please make sure to check out Photizo on their socials. And if you have enjoyed this episode, please make sure to like, share, and subscribe. For now, lots of love to you and your dogs, and I'll speak to you soon. Take care for now. Bye.
Bye.